Thank you very much. What I'd like to share with you over the next 15 minutes, or 20 minutes, if I can squeeze it in, is what did we say we would do and why? Give you a sense of a real social movement that is underway in the northeast of England. The building blocks to this, the key successes, the foundation we feel we have for the future and the challenges ahead. Those of you who work in tobacco control, I know, will be very akin to what the scale of this issue is. If we think about it, the North East has always had an handicap image. And back in 2005, when we were set up, we had the highest smoking rates in the country. And in fact, still now, 15 smokers every day are dying in the North East. There is no other known consumer product out there like tobacco, which will kill half of all of its consumers when it's used directly as its industry dictates, the tobacco companies. And these two photographs are actually from the American Legacy Foundation. But this is Brian, age 33, with his son, who was 5. Brian got addicted to smoking at the age of 14. The bottom figure is Brian 2 months later, the day he died from lung cancer. And I think many of us will know a story like Brian. There was a real recognition, though, in the North East that tobacco is such a cross-cutting issue. It can't just be the NHS's problem to sort out. And we recognised in our region that others were doing better in the UK, but also elsewhere in the world. So actually, what we said we would do back 7 years ago was go to the EU, ask for money to say, let's not reinvent the wheel. There's somewhere in the world that's absolutely trailblazing how to reduce smoking prevalence and inequalities. That's California, Massachusetts. You may laugh, but we said we can be like California in the northeast of England. And this was essentially around taking a comprehensive social norm change approach, which would be more effective in terms of reducing tobacco use than simply putting all of the eggs in the basket in terms of focusing on individuals who smoke. And we'd use this evidence base and adopt the key principles. And this is about changing the broad social norms around the use of tobacco. And it's essentially about indirectly and directly influencing current and potential future tobacco users on a population level by creating a social environment, a legal climate in which tobacco use, and I would argue its industry, becomes less desirable, less acceptable, and less accessible. And whilst for the last 5 years we've absolutely emphasised this social norm change approach, help to smokers to quit through the NHS has also been strongly supported and encouraged. And we would deliver a multi-component programme around 3 key principles to motivate and help smokers to stop, to prevent children from starting to smoke, and protect people from exposure to second-hand smoke and other tobacco-related harm, such as illicit tobacco. Well, hey, we were very ambitious to become California, and the EU bid was knocked back. But we decided to not allow a setback to stop us. The bid was unsuccessful, but actually it galvanised so many partners: health, local government, business, the Regional Development Agency. So a bold decision was made that, sod it, we would go ahead and develop a dedicated regional programme to support local activity, to have the steer and to provide expert leadership from a dedicated tobacco control office, which has been a tiny little hub of 6 posts for the last 5 years. We'd have a strong strategy to unite partners and to provide a framework for action. We'd need to have a clear brand and identity. Our competitors are things like Silk Cut, Benson and Hedges. Everybody knows what that brand is. We need something to compete against that. And to have very clear messages, but many different messengers from many different places saying it, and have a bold vision, a smoke-free Northeast. The vision is smoking is going to become a thing of the past, something that people used to do. So there's been a regional board in place overseeing this programme for the last 6 years, and there's a real sense of we and a collective partnership that it's everyone's business. So throughout this programme, we've been building support and consulting all of the time on what we do. From the very early days of actually saying, you know what, we need to have a law that protects people from breathing in second-hand smoke in the workplace, to a strategy as to how we would galvanise action around that. We'd have a strong aspirational brand to unite the region, thus the fresh brand. You know, we made no bones about actually we need to bring in the expertise from the private sector in terms of a media agency around this. We wanted something that was public facing, that reached out to smokers and non-smokers alike, that would never be seen as being anti-smoker, but to have a clear vision of what needs to change and why. And recognising actually when we think of smoking, 90% of smokers get addicted when they are still a child or a young person under the age of 19. This talk about being an adult-informed choice that the industry says ignores the fact that smoking is actually a childhood addiction, and also ignores the fact that 7 out of 10 smokers say they want to quit, and 9 out of 10 reach a point where they deeply regret having started in the first place. In fact, in the Northeast just recently, the team was at the Tall Ships Festival in Hartlepool, and over 3 days, 4,000 members of the public came up to our stand. Many of them smokers themselves who said, I'm really struggling to quit, but I'll kill him if he starts smoking. What can you do to basically turn off the tap of smoking? It was to have longevity, not a one-off. It was never just about campaigning for a smoke-free law, but would be relevant years later, and many messengers sticking to the same messages. The whole region has united around this. It's very much a sense of locally together. So every single PCT and local authority were given its own fresh identity, whether it be fresh smoke-free Newcastle or fresh smoke-free Middlesbrough. With at the central hub of this, it was the region together, working together. The last 5 years, we have regionally and locally stuck to 8 essential key strands. And when we think about the evidence base for public health, it's very strong in terms of tobacco control. Because this problem has been with us for so long and we're at this end stage of the epidemic, we have a huge amount of evidence, of research in terms of what needs to happen and change. So I make no apologies to say we've stuck to these 8 key strands over the last 8 years. From very importantly developing infrastructure, skills and capacity, to share the expertise, to hear what's working. If it's working brilliantly in Redcar and Cleveland, let's have it rolled out into Durham, for example. To reduce exposure to second-hand smoke, not just smoke-free legislation, but now the concerns we have in particular around smoking in the home, but also in our prison sector, where people are still being exposed. Motivating and helping smokers to stop and ensuring that wherever they live, they get the best possible chance to quit. Bread and butter of the work is media, communications and education, communicating, bringing the public with us, making sure that we're never too far ahead of where they're at. Reducing an availability and supply of both licit and illicit tobacco products to our children and young people. Tobacco regulation and the fact that these products are largely unregulated and there are major opportunities ahead, such as around things like plain packaging. Reducing tobacco promotion, such as the fact that we really do need to get these products out of sight in our shops so that when children are in the shops to buy their sweets, they're not being exposed to a 4-metre wide display of very glossy cigarettes. And research, monitoring and valuation has very much been a key driver to our work. Absolutely, this is about fresh as everybody, and it's about constantly building partnerships at all levels. Great relationships and partnerships at the national level, the regional level and local level. And I think it's one of the most labour-intensive things, but you have to nurture those partnerships. You have to keep bringing new people on board, and you have to say to them, well, what's in it for them if they come on board? And actually, some of our closest allies, you could look and think, that's odd, getting into bed together. But for example, the TUC and the North East Chamber of Commerce have now been with us for 5 years in a row because they really get what this means in terms of their objectives. From working with the third sector, like the British Lung Foundation, the Association of North East Councils, and through Smoke Free Action with the fantastic leadership of an agency like ASH.